At some point, though it's hard to imagine now, the current revolution will end. Ultimately, all revolutions do end. They can't be sustained. And when ours does, we'll wake up one morning in a country where we don't have to lie about everything all the time, where math is allowed, where we can acknowledge the profound and inherent differences between men and women without being fired for it. That day is coming. The question is, when it does come, what will be left of our society? We can't know the answer in detail, but here's what we're hoping for. We hope that reason remains. Reason, logic, the ability to think clearly and rationally. That's the one thing we can't lose. We're going to need it to rebuild. That's why, of all the moral atrocities being committed at the moment in the name of equity and inclusion, it's the relentless attacks on science that should command our special attention. So for the next hour, we're going to consider those attacks in some detail. And we're going to start with America's response to the COVID pandemic. When the coronavirus first arrived in our country last winter, most Americans uncritically accepted what the authorities said about it. They thought they could trust the people in charge. Few imagined that our leaders would leverage a public health emergency for their own political gain. That seemed like the one line that even politicians wouldn't cross. And yet almost immediately, they crossed it. Around the country, Democratic governors used quarantine restrictions to reward their allies and to punish their opponents. Abortion mills stayed open, but the police kept churches closed. You could buy weed, but you couldn't get your knee replaced. Demonstrations against the lockdowns were banned. Riots against Donald Trump were encouraged. Watch the governor of Michigan, for example, shamelessly explain the difference.
It is probably not going to be safe to congregate in masses for quite a while. And it's heartbreaking, but we know that Michigan's not alone in this moment, that this is what is happening all across the country, that these big gatherings just can't safely happen right now. The death of George Floyd has once again shone a light on the systematic cycle of injustice in our country. To the overwhelming majority who have taken to the streets and protested peacefully, protesting historic inequities Black Michiganders and those across the country are facing, I hear you, I see you, I respect you, and I support your efforts to enact real structural change in America.
So you are no longer allowed to exercise your constitutional right of assembly unless it's to publicly support the Democratic Party. And it wasn't just the governor of Michigan. Gavin Newsom did the same thing in California. Phil Murphy did it in New Jersey. It was partisan politics posing as science. And this was the most amazing part. In the end, it was endorsed by actual scientists. And that's the part that should worry you. Doctors like Jennifer Nuzzo at Johns Hopkins University told us that structural racism was a bigger health threat than the coronavirus. So go ahead and loot Macy's. It's an important part of public health. For those who still believe that American science was on the level, this was a shocking moment. When did the people who are paid to be rational become corrupt religious zealots? When did our scientists become ayatollahs? Well, it happened years ago, it turns out. The rest of us just weren't noticing. In February of 2019, a piece was published in the journal Neurology, which, in case you don't read it, is one of the preeminent peer-reviewed publications in all of medicine. The piece was called Lucky and the Root Doctor. It described a physician's experience with a man in the Deep South called Reggie. Reggie was suffering from a severe neuromuscular disorder which had left him blind. And Campbell believed in Western science. He did not believe that voodoo is the cause of blindness. And the piece he wrote was designed to help other physicians communicate with patients like Reggie so those patients could receive effective medical treatment. Unfortunately, American medical journals are no longer allowed to criticize witchcraft. Criticizing witchcraft is racist. So the editor of Neurology, a man called Robert Gross, began a purge of his own publication. He fired the humanities editor, then he suspended the entire humanities section. And then to further atone, he hired what he described as a deputy editor for equity, diversity, and inclusion. Then Robert Gross, as if this wasn't enough, wrote a groveling apology letter for the piece, calling Campbell's article racist and acknowledging it had caused, quote, anguish. Nowhere in that letter did Robert Gross explain any of this. Why exactly is it racist to prefer Western medicine to witchcraft? Isn't that the whole point of our system? Gross never explained. He just declared it racist and moved on. So that's now the official policy of this country's top neurology journal. that witchcraft is the same as Western medicine. And how dare you say otherwise? Where does this leave you? If you were nervous about brain surgery before, this is not comforting news. How long before your doctor sacrifices a chicken in the operating room? That's a serious question. We can no longer say that science is better than voodoo. That's racist. Something similar has happened in the world of economic research. One of the top business journals in the world, the Strategic Management Journal, deleted a paper from the internet without any explanation. Now, the key thing to know is all of the numbers in that paper were accurate. The data were right. No one claimed otherwise. The piece went through peer review. It was published. The piece was published because it was called this, quote, "Examining Investor Reactions to Appointments of Black Top Management Executives and CEOs." Now, we don't know what those reactions were. It might be interesting to know, but you can't know because the original version of the piece has disappeared. It's gone. It's now in the remote cave where we hide uncomfortable facts. It's been replaced by a heavily revised version. So what's the truth? We can't know. This is the definition of corruption, but it has spread through science. Take a look at the jobs postings at Nature magazine. Nature was once the foremost science publication on the planet. What Nature is looking for now in its employees has nothing whatsoever to do with science. In fact, it's anti-science. Here's one recent job posting they posted on Twitter. Quote, "As part of our commitment to foster diversity and inclusion, we are looking for a black candidate with a passion for science communication based in the UK for a full-time paid news internship." End quote. So the thing that jumps out is that no whites or Asians or Hispanics are allowed. Is that legal? Of course it's not legal. But that's not really the point. The bigger problem, and it is bigger than civil rights law, is that the people we trust to make the most important decisions in our society, the essential decisions, what kind of medical research do we fund? Who gets treatment and who doesn't? Who lives and who dies? The people who make those decisions are no longer rational. They have lost the ability to think empirically. Equity is now their god. They no longer believe in science. That's a real problem for the civilization. Victor Davis Hanson has watched the rise and fall of civilizations through the perspective of a historian. He's a senior fellow at the Hoover Institution. We're happy to have him join us now. Professor, thanks so much for coming on. So what does it portend for the future that science has been so completely corrupted that it is dictated by political demands rather than by observable facts?
Well, I think we're watching the legacy of the people who put Galileo in jail. Remember, they said that the Earth was the center of the universe and solar system, and Galileo was a nut for saying that planets revolved around the sun. So there's a pattern here that we have these bi-coastal elites with letters after their names, and they say, right here, science stops. There's no new development, no new inquiry, no new data, and they use it for ideological, political, even financial gain. So even look at it permeates all elements of our society, Tucker. The Steele dossier was passed off as expertise by an expert in British intelligence, and we knew that was true because the head of the CIA at one time, the head of the FBI, James Clapper or James Comey or John Brennan, all of these people came in and they assured us. And then guess what? It just disappeared. He was not a traitor, Trump. There was no reality to any of the charges. It turned out that Christopher Steele was indirectly through firewalls working for Hillary Clinton. John Brennan and James Clapper had lied under oath to Congress. Robert Mueller, who based all of his investigation on that dossier, couldn't even remember that it existed. James Comey, 250 times under oath to Congress, said he couldn't remember much about it. And so then we moved on to, you talked about the Wuhan virus, but only an idiot, science told us, would think there was a connection between a level 4 biology lab with associations with the Chinese military and conducting gain-of-function research a mile or two away from the supposed origins by a bat, or maybe it's a pangolin, of the virus. And anybody who suggested that didn't know anything about viral sequencing. And yet that's probably a much more likely scenario. Dr. Fauci, no need to go there, but he's told us masks are essential. They're not essential. One mask is okay. No, two is better. And he said herd immunity is 60, 70, 80, 90%. And every time he was caught, he reverted to the Platonic noble lie. I just lied because it was for your own good. And then remember those weird 1,200 medical professionals who said, you know, given our expertise, we think the science says if you're going to protest for BLM, you don't have to shelter in place, you don't wear a mask, you don't even have to social distance. Go out and protest. In a way, apparently, that it was scientific to say no to a religious congregation or a Trump rally. And so, you know, we have this pattern, and the funny thing is, Tucker, there is a personal agenda, as there always is in history. When somebody at Moderna says we have to vaccinate people who have had COVID and have antibodies, or even children, we wonder, well, it couldn't be that 9 people made $20 billion off the vaccination. It's in their interest. Or that Dr. Fauci was engaged in funding indirectly enhanced research at Wuhan. Or when Bill Gates said follow the research, that he has considerable financial interest in China. Or, you know, Christopher Steele was a good friend of Hillary Clinton, or at least wanted to be, and there was an effort to destroy a presidency. And that's how science is perverted. It always is, for ideological and financial reasons.
But without it, we can't really continue in an advanced society without science. I appreciate that overview.
You can't.
Victor Davis Hanson, great to see you. Thank you. Well, one of the many topics that scientists are no longer allowed to discuss openly is why so many young children are trying to change their biological sex. Abigail Schreier is one of the very few people who has not gone along with the mandate and has done her best to study the data, looked at it clearly. Next, she tells us what she's found.
Society for Evidence-Based Gender Medicine is formed. It's a consortium of doctors from across the West who are very concerned and oppose affirmative care. But the problem is that the problem is much worse than that doctor in 60 Minutes said. The reason is because doctors in America are afraid of losing their license. Nearly every medical accrediting organization has adopted affirmative care, which means that the doctor's job is to affirm or rubber stamp the patient's self-diagnosis, even of minors, when they decide that their problem is gender. So there's a real problem, and in the 20 states in America that have conversion therapy laws, doctors are absolutely afraid that they could face civil and criminal penalties if they say, wait a second, this may not be gender dysphoria, that's the problem, let's explore other options.
Well, that is shocking. Is there any other procedure or series of procedures to which that applies? If I walk in and say, I want chemotherapy, and the physician says, I'm sorry, I don't detect cancer, I want it anyway, the physician could turn me down for that treatment, right?
Absolutely. I mean, this is the only area of medicine where we do this, and it's basically turned our doctors into life coaches. It is profoundly unscientific. It tells them not to use their medical judgment and instead just rubber stamp the patient's wishes.
Where were the rest of us when this happened? Until you just said it, I didn't know that medical associations can revoke the license of physicians who don't play along with this essentially a political movement?
Well, I mean, you know, we've seen some of the really giants in the field of gender dysphoria have been deplatformed or canceled. Ken Zucker, you know, most famously, who chaired the committee who wrote the definition of gender dysphoria for the DSM-5, that's the psychiatric manual, yes. He was fired in Canada, you know, because activists called him a transphobe.
I wonder at what point do we look back on this, and a lot of other things we've done in medicine, I will say, giving heavy-duty drugs to kids who don't need them, but do we look back on this and recognize it for the tragedy that it is? Like, how long is it going to take, do you think?
You know, I don't know. I have a feeling the lawsuits will start coming, but because, you know, they can attack me, they can try to discredit the scientists who have done good research into this and have shown affirmative care does not show the mental health benefits that the activists claim. But the
yes.
one thing they haven't been able to cover up is the detransitioners. Young women who are regretting that they were pushed through these treatments, they're speaking up all the time, more and more of them.
Man. Your bravery is a case study on how one person refusing to back down from what is true can make a huge difference, and I'm just grateful for what you've done. Thank you. Abigail Schreier, good to see you.
Thank you so much.
We're going to take a quick break from science for a moment and turn to religion, because on some level they are connected. We had a really interesting conversation with a Catholic bishop, Archbishop Chaput, on Tucker Carlson today. He says the core problem with today's society, the reason so many are so unhappy, is because people have been told and they believe that they have the power to change nature. And they can't. No one has that power. Here's part of the conversation.
You know, Catholics talk about original sin. Other Christian communities talk about the sin of Adam and Eve, which it was they wanted to be like God. They didn't want to they didn't want God to tell them what to do. They wanted to do it their way, and that's we consider that an act of idolatry. Instead of giving God His due, you give to someone else or something else what belongs to God. That's called idolatry. It's a foundational sin. It's the most dangerous sin, and it's led us down this path of making ourselves the center of creation.
Do you notice in a lot of the issues that dominate politics the desire of people to pretend that they are God?
Well, I think the gender issues today are the prime example of that, where we're not even satisfied with the body that we're born with, that we think we have the power to become something that we were not created as.
Yes.
That I can become a woman, or a woman can become a man. That's something that God does, not something that we do. But that, in some ways, that's the final rebellion against God. You know, the sexual revolution was a great rebellion against God. It was a rebellion against the way God made our bodies and the way God created human sexuality. But now it's come to the point where we even think that we should have control over the kind of human beings we are.
A really interesting and long conversation that you don't have to be Catholic to enjoy. This is someone who spent 80 years thinking about life and what comes after. Really interesting. That's on foxnation.com. So a question relevant to, I don't know, maybe 100 million Americans is it safe to take the corona vaccine if you've already recovered from COVID? One of the most basic questions, but until now, no one has bothered to answer it. The few who've asked it have been shouted down. Tonight we have data, and it's a little different from what you've been told. That's next. A long time ago.
The most unprecedented thing that we're doing in this vaccine campaign is that we're deploying it indiscriminately into folks who have been recently or previously infected. And I think that we shouldn't underestimate what the effect of a vaccine-driven immune response is on the tissues in individuals who have been previously infected. Literally, the antigenic footprint of the virus persists in the tissues of the previously infected. So it's not a far stretch to imagine that those tissues, such as the inner lining of the blood vessel, would be targeted by the vaccine immune response. And you know, I have not yet seen any evidence, frankly, of the FDA or CDC taking this seriously. You know, I think it's a major mistake to assume that you can put this vaccine into people who've been recently or currently infected and expect that, you know, no complications will result.
So people who don't need the vaccine are being compelled to get the vaccine. That's not an argument against vaccines. It's an argument against the misuse of medicine. Any medicine, including vaccines. Rand Paul is a physician. He's also a U.S. Senator from the state of Kentucky. He's been infected with COVID. Obviously, he recovered. He's just written an op-ed on why so many are denying the science of natural immunity to COVID. We're happy to have him join us tonight. Senator, thanks so much for coming on. So will you just clarify, as a physician, in a sentence or two, how people who have recovered from COVID, the many tens of millions who have, should feel about their chances of getting reinfected?
Well, people need to understand that vaccines, the science of vaccines is based on the science of natural infection. What they're trying to do with the vaccine is to simulate and get the same response that you get, or better, with a natural infection. Some diseases, like measles, when you get them, you actually have lifelong immunity. If you get vaccinated, after a couple decades, you need a booster. So actually, natural infection is actually better than the vaccine in some ways for measles. Now, this isn't an argument against being vaccinated. It just happens to be if you got the measles, you've got lifelong immunity. Smallpox was the same way, but it's not an argument for getting smallpox. With COVID, we don't know yet. What they say all the time is you don't know how long you'll be immune. Well, I can look right back at you and say, I don't know how long the vaccine will work. They're already talking about a booster. When Dr. Fauci comes before the committee and we ask him, how many of those who are vaccinated already have the disease? He has no earthly idea. They're not even counting them. Even a good scientist would say we should look and see whether those who've already been vaccinated are somehow responding differently. I did see one study that showed that if you've already had the disease and you get a vaccine, you get 1,000 times greater response. Now, maybe that means 1,000 times better, or maybe that means you're more likely to get symptoms and side effects. So I don't think it's been studied thoroughly. I do know that in Israel there was a study recently, and it showed that those who were vaccinated and those who were infected naturally had about the same possibility of being reinfected, pretty small.
I'm a little confused by this. I mean, if your job is to promote and then disseminate the vaccine and compel people to take it, which is what we are doing, college students can't go back to school without it. So you're forcing this on people. Isn't it your moral obligation to find out what the potential harms are, what populations should get it, which shouldn't? Why are they treating everyone the same and refusing to ask obvious questions?
Well, there's a huge public policy or public health question. In India, they don't have enough vaccines. So if Dr. Fauci is advising the world, which he seems to want to do, what should he tell them there? Should they give the vaccine to people who already had it, or should they save the vaccine for those who haven't had it? So this is a profoundly important question for a country that has 1 billion people and might have 200 million vaccines. Should they waste the vaccine on people who've already gotten it? The science says no, but Dr. Fauci says, no, we're all lemmings, submit. It's more about uniformity of submission and less about science.
These people are scary. And I appreciate your asking obvious questions. And thank heaven you're a physician. You still have a right to do that, I suppose. Senator Rand Paul. And for now. Thanks. Good to see you. Thank you.
Thank you.
What's so interesting is that a lot of people in public health seem in private to agree with what Senator Paul just said. Earlier this month, the heads of the FDA and the CDC, as well as Tony Fauci, admitted that about half of their employees have decided not to get vaccinated.
What percentage of the employees in your institute, your center, or your agency of your employees has been vaccinated?
You know, I'm not 100% sure, Senator, but I think it's probably a little bit more than half, probably around 60%.
Dr. Marks?
I can't tell you the exact number, but it's probably in the same range. Some people vaccinated at our facility and others at outside of the facility.
Dr. Lewinsky?
We're encouraging our employees to get vaccinated. We've been doing town halls and education seminars. Our staff have the option to report their vaccination status, but as you understand, the federal government is not requiring it, so we do not know.
Really one of the most remarkable tapes of the past year. So as people who work full-time in public health at the CDC, at the NIH, approximately half of them have refused to take the vaccine at that exact moment. And by the way, why? That'd be a good follow-up question. No one asked it. Why? But at that same moment, we're forcing kids to get vaccinated. College kids, many can't return. They're telling you to give the vaccine to your small children, too.
With the vaccine 100% effective for children in the clinical trial, the vaccinations are the best shot, say experts, for a safe return to school, to summer camp, and for sleepovers.
Trials are still underway for children as young as 6 months old, but by the end of this year, Dr. Fauci believes there will be a vaccine available for nearly all children.
A vaccine in the works for children as young as 6 months old. What should we think of this? Dr. Harvey Risch is with the Yale School of Public Health. Dr. Risch joins us now. Doctor, thanks so much for coming on. What do you think of that?
Pleasure.
Children getting the vaccine.
Well, the first problem that we have is we've dumbed down the discussion of everything. So we're at the level now of vaccine good, COVID bad. And, you know, other facts relating to that are just kind of inopportune. The problem is that children get the illness perfectly well, almost entirely. And for children who have obesity, diabetes, chronic illnesses that put them at high risk of bad outcomes from COVID, they are the ones who might consider being vaccinated. But for almost everybody, all children otherwise, it doesn't make sense because their risks are negligible. Now, the CDC has addressed this with its data. So it's seen that in approximately 470,000 Americans who've died from COVID, that includes approximately 400 children who've died either with or from COVID. That's not zero, but it's a very small number and comparable to children who've died from influenza in past flu seasons. So there's no real reason why children need to be vaccinated, because they get immune from just their own interactions, and they don't transmit the illness to adults, and they hardly even transmit it to other children. Mostly children get it from adults, from their parents and so on.
So the whole reason we have science is to make the fine distinctions, such as the ones that you just explained. Why aren't the heads of our public health institutions saying exactly what you just said?
It's difficult for me to speak about why they think what they think. I think we're in a vaccine mania or a vaccine fanaticism stage, and I think that if the goals are to show proclaim your goodness by vaccinating everybody, then you're looking to jab everybody. If your goals are to solve a public health issue as best you can, then it's a trade-off, and you balance the risks and benefits as best you can.
I don't know how you've kept your head in the middle of this mania, as you just described, but I'm so grateful that you have. Dr. Risch, joining us tonight. Thanks so much.
Pleasure.
Well, no one is covering this story. There are too many stories, honestly, to cover, and too few outlets willing to cover them. But the Biden administration is appointing completely unqualified people to important scientific and engineering posts. What effect is that going to have on the country? You can imagine not good. Heather McDonald has studied the details of this issue, and we're happy to have her join us next. So what effect will that have on the country's competitiveness? Heather McDonald has investigated the implications of this for a new piece in City Journal. We're happy to have her tonight. She is, of course, a fellow at the Manhattan Institute. Heather, thanks so much for coming on. Give us, there's so much going on right now that it's just nice to talk to someone who's got a handle on the details as you do. Give us some examples of what's happening while the rest of us go about our lives.
Well, let's look at Biden's nominee to run the Office of Science in the Department of Energy. This is the largest funder of basic scientific research in the country. It's a $7 billion agency. It oversees X-ray synchrotrons, funds fundamental particle research, physics research, clean energy, nuclear fusion. Who is the nominee for this program, for this Office of Science? A soil geologist with no background in physics, who has never run a large bureaucratic organization, much less a large scientific bureaucratic organization. What are her qualifications? She's black and female. She's known for her promotion of diversity in her lab. She writes articles like a critical feminist perspective on transforming workplace climate. Here's a translation key, Tucker. Diversity is code for race and sex preferences. Given the vast academic skills gap, you can have diversity or you can have meritocracy. You cannot have both. China in the sciences is opting for meritocracy. We're opting for diversity. This is suicide for our culture and for our scientific knowledge.
At the same time, maybe we've stopped talking about it, but up until the other day, we were talking about STEM and the idea that we needed to educate our kids more rigorously in the sciences if we hope to be competitive in the 21st century. Fill in the cliches as you will. But there's some truth in that. We need to be competent in this stuff. Have we given up on that completely?
Well, we've given up on cultivating our top talent with all the resources we have. We are now trying to socially engineer a diverse graduate class of scientists based on sex and race, which are total irrelevancies to science. We should be finding the best possible minds, regardless of what their gonads and melanin are, giving them all the training we can. That is not what's going on. Every single science department in this country, in academia, is obsessed with race and gender. They don't care about scientific qualifications. They're screening people out based on the quality of their diversity, equity, and inclusion statements, which are just, again, mere fig leaves for being diverse and equitable oneself. This is not how we have advanced beyond the Stone Age. We did so by valuing knowledge and brilliance, and we are turning our backs on those capacities now.
Yeah, well, that's national suicide, what you just described. Hope it ends soon. Heather McDonald, it's great to see you tonight. Thank you. Depressing but important.
Thank you, Tucker.
Well, few areas of science are as dishonest and open to manipulation as the study of climate change. Some of it's, of course, unknowable, despite what they lie to you. Now, some people have devoted their life to environmentalism, saving the actual earth, the air, and the water, and they think science has taken a wrong turn. They're speaking out. That's next. An official at the UN claimed that, quote, entire nations could be wiped off the earth by rising sea levels if the global warming trend is not reversed by the year 2000, 21 years ago. Then in 2004, the Guardian newspaper in Great Britain warned us that, quote, Britain